will be graduating in May with a degree in music therapy from UMKC, University of Missouri, Kansas City. She'll be completing an internship at University Health Acute Behavioral Health in Kansas City in July. The research Karah is presenting today has been published in a research journal and presented at multiple venues. For the study you'll see today, as well as a second study she's currently completing that explores the education of music therapists who work in trauma care, Karah has been awarded the distinction of undergraduate research fellow. That's all super awesome. I'm so excited to hear from you, Karah. Take it away.
Perfect, thank you. I'm gonna go ahead and share my slides with y'all. So the study that I'm sharing with you today is called Exploration of the Referral Process of Social Workers Within a Law Enforcement Structure, and then Implications for Music Therapy. And I think this fits really well with the theme of our conference this year, which is all about, pushing forward into the future and expanding the practice of music therapy and looking at what the expansion of music therapy even looks like. And so I don't know of any music therapists that work directly with police departments like I looked at in this study. So even if this isn't something that you think you are interested in working in, there's a lot of basic principles either through the process of the research or some of the underlying themes that I learned that I think are applicable across multiple areas of practice in music therapy. So the first thing I did was I looked at the history of police officers as social workers. And I know that sounds a little bit contradictory, right? Because right now we think of police officers as law enforcement. So you call them when someone breaks the law, they come and then make a determination, is the law broken or not? And either if it is, they can take action. If not, they kind of just have to walk away. But historically, police officers were taking on more social work-esque roles. So if we think back to like the 20s and 30s, like the time when mob bosses were taking over, when government was super corrupt and it was all about who knew who, the police officers were part of that. And so if you needed a job, if you needed food, if you needed housing, these police officers were able to provide those services to you, of course, in exchange for then loyalty to whatever mob boss they worked for. There was a bit of a revolution in the 80s where we kind of decided we didn't really love government corruption anymore, and that went away. And that was when we entered this current era of policing, which is that very black and white, strictly law enforcement focus. But of course, that isn't the only need that people have when you call the police. Sometimes there's underlying things going on. And so it's been this recent development that police officers and police departments are starting to directly employ social workers. And so it's happening in smaller police departments in New York, in Kentucky, in Wisconsin. The first major city to directly employ social workers is actually Kansas City, where I go to school and where I live now. So that was super exciting. And so I did a study in one of the cities that directly employs social workers. And the social workers are now filling in non-law enforcement functions, which is a lot of like connecting people to related services that provide resources or other things that they need. And of course, now that we've integrated social work into policing, there's that whole new dynamic of interaction that needs to be unpacked. So police officers fit in a very paramilitaristic structure, right? There's the chief is all the way at the top. There's a pyramid of hierarchy down to the uniformed officers, this like the patrol officers at the bottom. It's very respect-based. It's very rigid. There's a lot of procedure and structure, and you have to do things the way that they're prescribed. And again, that black and white view of does it require law enforcement or not? Social workers, on the other hand, are very similar to music therapists. They work through a very holistic view of a client. So they're looking at how to improve overall quality of life. And that includes every area of life, from physical needs to spiritual needs and emotional needs, and dealing with any kind of mental or physical health issues. And they don't look at their role, even when they're working in a police department, as law enforcement or not. They're filling in those gaps, right? And because they have different goals, there can be issues when they try to work together because they just don't, these two groups are just not even on the same page. And so can be breakdown in communication. It can mean that there's difficulty with the social workers achieving their goals because the police officers just don't put any emphasis or respect or interest into helping that happen. And there can be some breakdown. And of course, the last area that we needed to look at was then, is music therapy effective in the areas that police officers are seeing clients? And so all of these studies that you see on the right side refer to a myriad of practices in music therapy. And this is one of the areas where it becomes applicable to a lot of us, because while you might not specifically think that you want to work in in areas related to the criminal justice system or related to a police department. You might be working in sexual assault, you might be working in trauma recovery, in building resilience across a number of populations. And that's what these studies are looking at. They're finding that music therapy is effective in rebuilding positive relationship patterns and abilities after a child is sexually abused. It's looking at using music therapy to manage somatosensory treatment of trauma. So, music therapy and the way music interacts in the brain can link back in your nervous system and help to regulate you when you're working through trauma, help the client regulate and help you regulate when you're working with them. It looks at building resilience, which of course is a necessary goal for anybody, but especially with these clients seen in a police department. So these are victims of sexual assault or domestic violence. These are individuals who are experiencing homelessness or food insecurity or general issues with living below the poverty line. And they're also witnesses of crimes. So it might be that a homicide is committed on the street and a 5-year-old watched it happen. And now that little 5-year-old is dealing with the trauma of what just occurred. So all of those situations are going to require resilience, especially when you think about the fact that something like homelessness or food insecurity doesn't just go away. Even if the social worker is able to provide resources that gets them food for the next week or for the next month, what's going to happen after that? Is a month worth of savings really enough to prevent that from ever happening again? And so building resilience to help when it's a continued traumatizing situation is super important. And some of the individuals seen by police officers are also offenders. So maybe they're in the system and they just came out. Maybe they're coming up as reoffenders. And so some of these studies looked at music therapy is effective when working with offenders in anger management and was able to reduce the number of negative coping skills used and increase the number of positive coping skills used. And it's also effective when PTSD is a comorbidity with another mental health diagnosis. So anytime there's a comorbidity, we know that makes it more complicated, right? Because there might be different neurological things happening. There might be a different set of traumas that are influencing those symptoms. So the fact that music therapy can be effective when PTSD is a comorbidity is super exciting and interesting. So the answer to that whole summary is yes, music therapy does have efficacy in the individuals seen by police departments. So this was the first study that I ever conducted, and I did a lot of learning before I started and how to run a study. And so this is another area that I think is applicable across different clinical practices, because all of us know and love that music therapy is evidence-based, which means we do spend a lot of time reading research articles, informing new interventions, developing our own protocols and testing them, like in the case studies we saw earlier. And so knowing what goes into that can make you a more informed consumer of research and also encourage you then to go out and do your own research, because this is how the field advances, right? As we start moving into these new areas. So the first thing I had to do was find a theoretical framework that worked for me. And in this case, it was phenomenological. So this was a qualitative study, meaning I didn't take any numbers data. It was all about interviews that I conducted and words that I was getting back, described experiences. And specifically, I picked a phenomenological approach because that means that I'm just studying the phenomenon and I don't know what's going on. So I was able to find studies that looked at different aspects of social work in policing, like those studies that looked at interactions. But this particular study focused on the referral process because that's where music therapy would come in. The social workers themselves are not delivering services. They're sort of a liaison to the services that individuals need. We would be one of those related services, so I need to know how that referral process works to see if we would be able to integrate to what they're already doing. And I don't know what it is. So the point of this whole study was just to get as many details as possible to figure out what was going on. I didn't have a hypothesis or anything like that going in. But of course, when you're working in qualitative data and phenomenological data, it does open up the possibility of bias. So I, as the researcher, was the one who picked the question. I wrote the interview scripts that I used. I conducted all of the interviews, and then I coded the data. So there's a possibility that my thoughts about the data were coming in to the study results and possibly biasing what I was getting. So in an effort to, of course, I can never know that I fully negated that, but I took as many steps as I could to prevent that from happening. So all of my interview scripts were reviewed by 2 professors who were mentoring this project, Dr. Dawn Iwamasa, who's a music therapy professor, and Dr. Ken Novak, who was a criminal justice and criminology or CJC professor at my university. Dr. Novak also sat in on several of my interviews to watch how I conducted them. And then I ran all of my data analysis past them before I finalized the paper. So we were doing as much checking through that as we could. In terms of data gathering, I ended up doing 9 total interviews, and the subjects fell into 3 categories. So, first, I interviewed the social workers themselves. Second would be patrol officers or uniformed officers who regularly interact with the social workers. And the third one was administrative and command personnel. And so, this is one of the areas that was really interesting as a researcher because, as I mentioned before, police departments are very hierarchical. It's very militaristic, and that means I couldn't just show up to a uniformed officer and say, hey, I'd love to interview you, is that okay? I had to get permission. So my professor, my CJC professor, Dr. Novak, had to start at the chief of police in this department and get his permission for me to start this study. And then I was directed to the major in charge of the HR department, who gave me permission to talk to the social workers. And then to get to the command staff and the uniformed officers, I was put in touch with the major of one district. So the whole PD was broken up into a series of geographical districts that each covered their own little area. I was put in touch with the major of one of those, and then he picked officers that he knew interacted with social workers. So this was purposive sampling, meaning that we picked these people on purpose because of partially convenience of who would talk to me and partially because they have direct experience to what I'm looking for. So it wasn't randomized. The interviews were about 45 minutes and they were semi-structured, meaning I came in with a list of questions, but I did tweak the wording slightly or ask follow-up questions as needed so I could get as much data as possible. In terms of data analysis, each interview was recorded and then turned into a transcript through a software, and then I went back through the transcript and pulled out the answers to every question that I asked, and then I coded them on sticky notes, which, believe it or not, is in peer-reviewed research journals as an acceptable way to code qualitative data. And so I took the answer to each question and put it on sticky notes. They were color-coded for the 3 subject types, and then I put them up all over my walls, and I was able to look for emerging themes. So within each question, did all the social workers answer the same? Did all of the interview recipients answer the same? And then I could move them around and look at what the even more overarching themes were. And so we'll get into those themes. The question answers will be in the results section, and then those overarching themes will be in the discussion section. And then the second thing I did was I coded the data through Maslow's hierarchy of needs. So I'm pretty sure we're all familiar with this concept that Maslow created, where basically you need the most necessary things like food and water and housing to be filled before you can work all the way up to higher like self-actualization needs. And so I looked at the reasons that referrals were made to the social workers, the reasons that social workers referred out to other services, and coded them through Maslow's hierarchy of needs. And you'll see those graphics in a little bit. So the first thing that I looked at was the social worker role, because again, we don't know what we're looking at here. And so I was just trying to get a grounding of where we're starting. So the social workers come in every day. They'll each have an office that they work from, and there's one social worker assigned to each of those geographical districts that I mentioned earlier. Their daily activities include following up on existing referrals, making contacts with new organizations, working with new clients, and also sometimes they'll go out on ride-alongs with officers. So rather than being based in their office, they'll hop in a patrol car and they'll just ride around on that patrol until a call comes in that it would be useful to have a social worker on. And then that car will go respond to that call. They interact with all of the personnel, which is interesting because, again, I keep mentioning this hierarchical structure, right? So a uniformed officer will work with the other uniformed officers in his level, and then it just goes straight up in terms of command. But the social workers don't quite do that because they're not sworn officers. And so in theory, in the police department, there's one hierarchy over here, which is for sworn officers, uniformed officers. And there's one hierarchy over here for civilian members. So these are people who work in the crime lab, who work in the office, who work in maintenance, and the social workers. But the social workers don't report straight up the civilian hierarchy. They sort of like bounce around in both sides. So they're really interacting with people at every power level, which is kind of like crazy in this militaristic structure. I also asked a lot of questions about the attitudes and perceptions of social work because before we bring in this related service of music therapy, we need to know if the existing program is even accepted and viable. And this was an interesting section because overall the answer was yes, we love the social workers. They have a positive impact, they're effective at what they do. But there's a catch. And the catch is that it takes time for the social workers to become accepted. And I'll get into the reasons for that more in the discussion section. But officers noted that they themselves had to have a personal positive experience with a social worker before they felt that the social workers were accepted and useful as an employee. So this means an officer would have to refer a client to a social worker and then follow up and see that the client received services from the social worker before they will accept that position of social work in the PD. They also noted that older officers were more likely to hold out and be resistant to the idea of social work. In terms of the referrals to social workers, the process is that there is no process. So they could receive referrals, a sticky note on their desk. It could be a text message, a phone call, an email. It could be a ride along where they're already out and about, or they might get a call that says, like, hey, I'm at the scene and I've got a victim who's going to need you. Can you come out? And they'll come out immediately, or sometimes they'll follow up afterwards. So there's really no process there. And the same thing kind of goes for referrals out from the social workers. So this referrals from means when a social worker is giving a client contact to a nonprofit or to a service that's going to provide them resources, what does that look like? And the answer again is anything. There's a couple considerations that kind of come into place. The first one is being cost. A lot of these individuals are receiving services because they already don't have enough money to take care of all of their basic needs. So the service has to be either free or on an extreme sliding scale so that it's a viable option. Second is location. So again, these individuals, because of this lack of financial stability, don't necessarily have their own cars. And so if they're using public transport, is the location they're going to close to a bus line? Is it close enough to their house that they're not spending hours on end on the bus, and that they can make sure they're still supporting their job and their childcare? Um, so then when we look at the resources themselves, there's no requirements in place in this police department for what resources are referred out to. And it's really every type. So it could be a nonprofit, it could be a government agency, it could be just a local church or community group that provides food or clothing or something like that. Um, and again, those requirements are very similar to the considerations. So like, is it cost effective? Is it close to where the individuals are? And then the last section that I asked all of my subjects about was music therapy. So first, are you aware of music therapy? Only two subjects, both social workers, have ever professionally interacted with a music therapist before, and neither of those instances were at their current employment at the PD. It was at past situations working with at a children's hospital. They worked in an ER and had music therapists that came into that ER at the children's hospital. So most of them were not even aware that music therapy was a service. Every subject was provided the same definition of what music therapy was, and then provided examples of how it would be useful in terms of client types that they had told me about earlier in the interview. And every single subject agreed that music therapy would be a viable option. They thought that it would be very beneficial for their clients and that they would love to use it if they could. But there are a couple barriers in place. And so, again, these barriers are very similar to the considerations of the nonprofit resources. So, music therapy would be expensive. We all know that we're not always covered by insurance. A lot of these individuals are on Medicare and Medicaid, which don't recognize music therapy, and that can be severely damaging to them, their ability to get it. Again, the location. Can they get to the music therapy services? And then third is stigma. We all know that there's already a massive stigma around mental health, but especially in these lower income and minority neighborhoods, it's even higher. And so social workers are telling me stories about individuals who flat out refuse to go to therapy just because they thought that it's not something that would ever work for them because they tried it once and they didn't like it. And so overcoming that barrier to going to mental health services is going to be huge. So on this page, I was telling you about the referrals and coding it with Maslow's hierarchy of needs. So on the left side, this is Maslow's hierarchy of needs. And this center pyramid right here is all of the reasons that police officers will refer clients to social workers. And so this was asked of every interview subject that I had. And now you'll notice that the very bottom tier, things like homelessness, we as music therapists cannot just pull houses out of our tote bags, although I really wish we could, and wouldn't that be cool? But if you look at security needs and everything up above that, those are things that we as music therapists can help with, right? So working on processing child abuse or witnessing an assault, processing neglect and trauma. Of course, diagnosed mental health issues is something that we work in all the time, all the way up through addressing systemic trauma. And then this second pyramid looks at reasons that the social workers refer out to additional resources. And so I only asked this question of the social workers since they're the ones with the most knowledge about that. And again, the very bottom tier we can't help with, but security and up, those are a lot of the same needs that were on the pyramid on the left, and we can help with those. And again, what's especially interesting to note here is I keep coming back to this idea of the police are very black and white. The social workers are more holistic. And so the police officers only ever answered in physiological and security categories. All of the needs higher than security categories were reported by social workers. So that's another interesting reinforcing distinction to think of here, that the social workers, they're looking at invisible needs. Trauma is not visible. When you look at someone, you can't tell, if they've watched a homicide before, if they've experienced rape before. But when you're looking at a child, you can tell, if they've been beaten. You can tell if they're experiencing food insecurity because they're skinny or they're behind academically, those sorts of things. So interesting to note that difference of perception here. So in terms of the police social worker relationship and how they make and receive referrals, there's three super important elements to keep track of. So the first one is respect. We're going to keep coming back to this. If you take one thing away from the presentation, I promise it will be that police departments are hierarchical, for the amount of times I've said that already. It's hierarchical and it's based on respect. So officers need to respect their colleagues at their level enough to trust their judgment when they're on the scene, and there needs to be inherent respect moving up the chain of command. So you know that the people who are above you worked their way up there, that they're trained, and then you respect them and trust their orders as they come down. That must be in place. That same principle then applies to the social workers. When the social workers first came in, the officers didn't respect them because they didn't know what they were doing. They didn't believe that their service was valuable, and they didn't want their toes to get stepped on. They didn't want the social workers to come in and take away from what the police officers were doing. So the social workers need to earn the respect of the officers by proving that they're a complementary service, not a replacement service. And then proving that they're good at what they do. When they have positive client outcomes, then they'll be earning the respect of the officers. And of course, they need to be showing respect to the officers in the same way. And so this comes in the way that they communicate, in the way that their nonverbal body language of how they work in the same structure, and in taking on a lot of the verbal cultural aspects of a police department, which again, because it's very militaristic, is very straightforward. There's not a lot of details. It's black and white, right? And so the social workers need to be able to integrate to that form of talking and reporting. Second is understanding. The social workers came in and the police officers had no idea what they did. And in this particular PD that I studied, there was very little training on what went on. It's supposedly in an in-service training once a year now, but I was unable to get official confirmation that that would be happening. And it's maybe in one afternoon of training in the police academy for new officers, which is very, very little. And so there needs to be continued times for the social workers to report on what they're doing, what their outcomes are, how they best work with the police officers to increase understanding. And then the third element of this relationship that's so important, and fortunately I can say is already in place, is the desire to help. Social workers and police officers that I talked to were all so adamant that all they wanted was to be able to help more people in the community. And police officers reported this sense of frustration that they couldn't always do anything. So maybe they're called out for a domestic violence call, and that one partner is supposedly becoming aggressive with the other. But in a lot of abuse situations, the victim doesn't want to speak up about what's going on. And so if they can't get an official statement, they can't, in a law enforcement capacity, do anything to help that victim. And they have to just walk away. Whereas with a social worker coming in, they're able to provide resources to the victim of nonprofits that may be able to help them, victim advocacy services, legal aid for if they decide to leave and need to do divorce proceedings against their partner or anything like that. And so they're able to move beyond the law enforcement scope and provide whole care to the people that they're serving. And so the fact that this is already in place bodes really well for the future of police and social work programming. And then I looked at how to resolve the barriers to music therapy. And so, of course, the first one is cost. There's a couple options here. The first one would be a lot of the organizations that social workers work with are nonprofits who then eat the cost of whatever related services they're providing to individuals. And so if we were to become salaried under a nonprofit or contracted out under a nonprofit that would be able to pay for our services, that would be beneficial to the clients. It may be an option somewhere down the line to be directly employed on the payroll of the police department and then be able to provide free services to the clients. But again, because social work and police departments are so new, having treatment in a police department is many years down the line. And then the third option would be for a music therapist to be able to provide sliding scale services, which of course is a bit of a risky area to be in because we never want to ask music therapists to devalue our work. And so that again might be something where you have a private practice and you're able to make a living off of your private clients, so you can carve out some time to do free sessions or sliding scale sessions for the clients at the PD. Second is availability. The social workers reported they didn't know of any music therapy services that they could report out to, and this would have two potential explanations. The first would be that there are no music therapists in this area that I studied who are available or willing to take on this client base. That's possible. The second would be that they're there and just nobody knows about them. And so the two solutions to that would either be expand music therapy in this area. There's a niche there, a need that can be filled, where maybe somebody wants to open a private practice, wants to take on extra contract hours and fill that gap. Or if they're already there, they need to increase advocacy. And they may not know that the social workers can refer out to services. So making sure that music therapists are really exploring every option that we have to provide services and expand our business. The third barrier is stigma. And this is something that we all know we can't just like fix overnight. But again, it comes back to advocacy. So working with some of the resources that clients are already receiving, maybe providing talk therapy. So getting in with the talk therapists and adding us as an available service, or talking to there's some clinics that clients are referred to that provide sliding scale psychiatry treatment so that clients can get on medication for whatever their mental health needs are. So maybe working with those clinics to advocate for music therapy as a related service, not to replace their function, but just to complement it. And finally, the fourth barrier is location. So coming back to that issue of not having transportation, there's a couple ways we could fix this. The first one would be to be housed in a nonprofit or a private practice where the brick and mortar building is in the district of people that it serves. And this is a model that a lot of the current nonprofits employ, where they're housed in one police district and they only serve people in that police district. And this helps them not become overrun by need and also serve people who can easily access them physically. The second solution would be to prevent the individual from having to leave their house. And so that could be the music therapist traveling and doing in-house sessions, or it could also be telehealth sessions. And so now I wanted to go over a couple of takeaways specifically for student music therapists that came out of this study. And the first one is respect. We extremely undervalue respect when we work with clients. And of course, as holistic treatment providers, we have this inherent respect for people, right? Like I come into this session and I'm saying my client is a person, they deserve autonomy, they deserve to be able to express themselves, and I'm going to allow that. But there's a step beyond that. And here's the example that I'll use. When you're sitting in a class and your professor walks in the room, you know that that professor is in charge. You know that they have more knowledge than you do, and you're going to defer to them, right? They're in a position of power. We don't want that in therapy. When you walk into a session with a client, you are not the most important person in the room. And so understanding that respect has to be earned, your client has to feel that you're willing to let their respect be earned. And so I was seeing this even in interview situations. So an officer might be ordered to talk to me, but it's not like he just goes around meeting college students who are music therapy majors who are doing studies. And so I had to be able to talk in the way they talked. I had to be able to show them that I thought their experience was valuable, that I wanted to learn more about it, and they would become chattier as the interview went on once they realized that I respected them and I could earn their respect back. And so that's extremely important in every area of practice. And second, tying into respect is then rapport. So you need to be able to build rapport with a client the same way I did with my interview subjects in order to get them to tell you more things, because the more that they'll talk to you, of course, the more we can work through whatever issues they're having. Third is integration. And this is another theme that we've seen throughout, right? So the social workers came into the police area and had to figure out how to function within this existing system. That's very similar to what we as music therapists do a lot of the time, because a lot of times we're hired on to start a program somewhere, or maybe there's one other music therapist there, but we come in and we're new to this company culture. And so we have to learn to work in the way the culture is already set up. You have to be able to take and deliver notes in a way that other professionals, music therapists, or other therapies are going to be able to understand. And we need to be able to communicate clearly what we do and how that ties in with everyone else in a way that shows how important we are, but doesn't step on anybody else's toes. And so learning how to integrate to an existing culture is extremely important. And finally, the fourth takeaway is advocacy. The answer to almost every single barrier to music therapy is advocacy, because we all know that we're just not that well known in other professions, especially when you start to move away from other therapies or medical settings, it becomes even less well known. And so, understanding how to communicate clearly to non medical personnel, to non therapeutic personnel, what we do and why it's important to them specifically is huge. So, in conclusion, my recommendations for music therapists are to explore new service channels. So, to explore being employed by a nonprofit, to contracting out to government agencies or nonprofits when you're working in a private practice situation, and also to increase advocacy. So, continue exploring what those new service channels would look like, um, and not being afraid to push into something we've never done before. So there's not music therapists. I know of music therapists who work in prison settings, of course, in forensic psych, but I don't know of any music therapists who work directly with a police department. And so we shouldn't be afraid to try to expand our practice somewhere new with our advocacy work. And of course, because this was a phenomenological study, we've never studied this area before. It brings up a lot of implications for what future research should look like. And they kind of fall into two main areas. So the first would be the music therapy area. So we need to be looking at what are the music therapist perspectives on this? Are they out there? What do they think about working with a criminal justice setting like this? What do they think the barriers are? And that's what I'm kind of doing right now with my current study is looking at the education experiences of music therapists who work in trauma care to kind of, pin this all back again. And then the second area of research implications is in the area of this social work program. It's very new for police officers and social workers to be working together like this, like in this direct employment situation. And the police department that I studied have only directly employed social workers for 2 years. And so everything is still very much in motion. Like I said, there's no processes, no regulations, which is so odd for a police department that regulates everything else so strictly. And so continuing to come back and looking at how this evolves will very much inform how we present ourselves as a related service as new regulations come into place. So here are the references that I used in this presentation today. These are not all the references for the paper that I wrote, but if you're interested, I would be happy to share the paper with you or any of these additional sources. And thank you so much for listening to my presentation. And I can answer any questions that anyone might have as well.
I thought your presentation was very comprehensive.
Thank you.
I can't think of anything to ask. If anyone else has any questions, we have a few minutes. Go ahead and pop those in the chat. Yeah, super informative. Um, Interesting to think about how we can fit in within that structure that's already there with the social workers.
Kind of same question I asked Jacob, like why were you motivated to research this? What was your background in it prior to?
Great question. So I came into college thinking that I wanted to work like in stroke recovery. And at the end of my freshman year, I happened to make contact with the CJC professor and just sort of chatting with him. And I realized that I love the intricacies of trauma care, like the way trauma activates your brain and the way it's stored in your body, and how music therapy, because music can shut off some of those, like those parts of your brain that protect you by trying to prevent you from thinking about something scary, music can shut that off. And so I thought that was so interesting. And then I started tying that into criminal justice work and realized that there's no research base for music therapists who work in criminal justice work, and very little. And most of it centers on prison populations, not necessarily victim advocacy. And so I kind of just wanted to start something and see where it could take me.
glad you're doing this research. It sounds really important. I also think trauma is super important and fascinating and important to learn about. Good work. Any other questions for Karah? If there's none, I'm sure Karah would be happy to talk with you also privately if you do have questions. But if there's nothing else now, thank you again for that presentation.